Right. So we are living at a time, in general, it's a Cambrian explosion in terms of technology enablement, okay? And so when we talk about some of the things we're about to talk about, right, this happens to be a very effective way of looking at technology. Is the technology transformational? If I go around clockwise, is it high impact, medium impact, or low impact? And although the years are cut off, 2016 to 2019 plus. And we're going to talk a lot about deep learning. We're going to talk a lot about Internet of Everything, because Internet of Everything is sensors. We're going to talk a lot about over here the notion of cognitive computing. And the reason that it's important is because I know as I made my rounds to the teams over the last few days, several people said, we don't like AI because we want to be more compassionate, we want to be more humane. And the message is, that's exactly what AI is going to allow, okay? And I'm going to go into the details of that, but AI is going to allow medical professionals to work at top of license, okay? How many people are skeptical of that? How many people think I'm, okay, well, at least we got one honest person in the room. Let me try to convince you, okay? But give me a few minutes. Now, there's a new breed of products that have been named digital therapeutics. Anybody know what the digital therapeutic, or as it's commonly known, the digiceutical space? No? Okay. It turns out Boston, being a healthcare cluster, has become a cluster for the digital therapeutics world. So what you're seeing today is about 150 companies who have created these apps that have been tested for efficacy and approved by the FDA, okay? They're actually prescribed by medical doctors. They provide real-time guidance to patients, and because of the pharma capital requirements and the drug approval cycles and the fact that 85, 86% of all drugs fail somewhere in trial, the ability for far more rapid innovation for treatment of diseases is very prominent. Okay? And analysts expect to see a very, very big market in just a few years. Okay? So this is real, right? So here's one example, diabetes care. Here's a company called Blue Star, FDA approved. And there was a case study on their website. A woman said, I've been struggling with my diabetes for 20 years. Nothing worked. And then I'm now using Blue Star, and it gathers her data from sensors, and it helps her to manage her symptoms, okay? And so you can manage your side effects, you can manage your symptoms, you can have access to clinicians, and she says it's made a huge difference in her life. Here's a slightly different take on a digital therapeutic. It's from a company called Voluntis. This is all about, they're creating a companion application for use with pharmaceutical companies. Okay, so they're working with companies like Sanofi and Welldoc and Insulia. So this is a new wave of innovation that we're seeing happen dramatically. Some of these firms are growing very quickly. Okay, now let's go right into the heart of the beast here. Let's talk about the use of artificial intelligence at the point of care. Okay, and I was blown away as I dug into this. Okay, so a long time ago there was this guy named Thomas Edison. And Thomas Edison came up with a bunch of really interesting innovations, but the one innovation that he was best known for, and he's still alive, by the way, he and Elvis still hang together, okay? If you guys never go down to Menlo Park, New Jersey to his innovation factory, you should, right? For a guy like me, it's a pilgrimage to go down there and see what they're doing down there, okay? But I cannot begin to tell you how much changed when we went from mechanical and steam power to electrical power. And how most of the large trusts, they played the blockbuster game. They said, nah, that electricity stuff, that's a fad. That ain't going nowhere. We're going to keep doing what we do. And then a massive number of those companies went away. So that industrial transition from mechanical to electrical was huge. And I'm going to argue that we are going through a similar level of disruption, and that in many ways, artificial intelligence, deep learning, machine learning, cognitive computing, we can use all kinds of words, but they're all related. And many of you probably know Eric Topol, right? Topol is not a shrinking violet, right? I love the book title, okay? It's fairly recent. Combining the power of humans and machines to bring back the care in healthcare. Now that may sound counterintuitive. How can machines bring back care and therefore compassion? And so Dr. Topol, formerly chair of cardiology at the Cleveland Clinic, now director at the Scripps Institute, and a professor at a little medical school called Stanford, okay, says AI is teaching us why medicine is so damn hard. Because we're finding out that people are far more different than we thought they were, okay? Pretty important. Medical doctors are quite poor at diagnosing across specialties, right? This is just a summation of his book. When we compare the diagnosis of a doctor to an actual cause of death from an autopsy, we find that doctors are often wrong, okay? A vast majority of patients that take the top 10 gross-selling drugs get no benefit from those drugs. Wow. They should have read Moneyball, right? My God. And so AI can grade cancers or instances of cardiac disease that allow us to distinguish, to draw distinctions about the severity of these diseases and help us understand how and when to treat them in a way just we can't do today. So there's a lot of ways in which AI is transforming healthcare. I'm going to talk about virtual nursing assistants, administrative workflow assistants, error reduction, AI-assisted diagnosis, patient engagement. All of these things I think are very relevant for the people in this room and the people over the net. So Google, right? Google acquired a British company called DeepMind. And DeepMind was famous for many, many things, including winning chess contests. But Google has applied DeepMind to the healthcare industry. Let me just share a couple of examples. So they have a product called Streams, which is a virtual nurse's assistant. And they're running massive pilots in the UK National Institutes, the UK system. Brain mist there, right? Here's an example. 2,200, this is one day at the Royal Free Hospital in London. They were able to look at the results of 2,200 plus blood tests. 66 indicated a change in kidney function. 23 required an alert, and 11 of those required action. And I realize this is hard to read. 60% of those 11 were reviewed in less than a minute. 2 of them were able to be reviewed remotely, okay? And so there was a potentially fatal sepsis and a rise in potassium, okay? So think about for a second a nurse who has to look at 2,211 blood tests versus someone who has to, jump on 11. How different their lives are and how different their effectiveness is, okay? Google is getting very deep into the world of eye care. So they're using, right, so machine learning is when you use a lot of imagery and you start to train models. So DeepMind and eye care, doing AI-based retinal screen scanning. So glaucoma, diabetic retinopathy, and macular degeneration are 3 of the issues that they've made a lot of progress with. And in each case, you'll see that they are far more accurate in detecting these issues using machine learning than ophthalmologists or professionals are, okay? And they can now predict the possible death of a hospitalized patient 2 days earlier than a medical doctor can, which will allow MDs more time to effectively intervene, okay? It's not magic. Now, Amazon. And I realize there's some issues around putting things online, and I know a couple of teams said that you got a green light to do so. But this is the Amazon Comprehend Medical product, right? You take unstructured medical tests from doctor's notes, clinical trial reports, patients' health records, and you extract that information and you mine it and you analyze it, okay? And you identify relationships among all of this extracted information. That gives you a lot of insight about what you're dealing with, right? It's extremely powerful, okay? It's become so mainstream that I'm reading the sport pages of the New York Times on Sunday, and I get an ad for the Amazon SageMaker machine learning workflow, okay? So this is not something that is sort of way out on the left field. This is something that is mainstream enough that they're putting it into a general interest newspaper in my sports section. This is how mainstream this has become, okay? The Montefiore Health System has their own internal Center for Health Data Innovation, and they have created an application that allows them to sample 40 data points every couple of hours and assign an intubation risk score. And they're saying that they are able to correctly identify 63 of the patients that will have this challenge versus 20% that the medical professionals are able to create today. 3x plus, okay? None of this is a criticism of the medical profession. This is about augmentation of skills, okay? So let's talk about a couple of Medicare-related things specifically, right? How many of you know that that there's a health challenge, the deadline just passed literally a week ago, called the AI Health Outcomes Challenge, that is jointly hosted by the CMS and the AAFP, okay? Now, this is a longer version of a hackathon. This is what is called an X Prize. They're offering $1.65 million in prizes. The winner of this competition will get $1 million. The second place person will get about $250K, and the 6 other finalists will get $60K each. So these are the kinds of things that any organization that cares about the future of innovation in healthcare should be participating in on some level. The winners will be announced in early August, okay? And again, using AI and deep learning methodologies to predict unplanned hospital and SNF admissions and adverse events within 30 days for Medicare beneficiaries, using Medicare Part A and B data, develop innovative strategies that will predict to frontline clinicians and patients, aiding and providing clinical resources to model participants, okay? Sounds like it's right on target with the kind of stuff that you guys do, okay? So now, let's go talk to our friends, the venture capitalists. They've put venture money into 106 startups and counting that are using AI to transform healthcare, okay? That's a mini boom. Here's one, company called Viz AI. It's an FDA-approved app that allows for the detection of strokes caused by blockage in a large blood vessel. And what you're going to see, one of the common themes is almost all of these now have a mobile app. We are truly a mobile economy today. There's another one, Lark Health. If you don't know Forrester Research, they're a luminary on innovation, rating and ranking innovative companies. This was their most innovative digital health product in the world last year. Chronic disease prevention and management platform. Again, like so many, it's AI combined with devices and coaches, real-time 24/7 support and counseling. The CDC has recognized their diabetes prevention program, their hypertension program. 1.5 million users of this app. Clinically validated improved outcomes, published in 11 peer-reviewed journals, working with both large payers and large self-insured employers. So these are not toys. These are the real thing, okay? Here's an interesting one, a new company called IDX, and their mission is to use machine learning to help detect a lot of different abnormalities. The first one they're targeting is autonomous detection of diabetic retinopathy, something that Google Mind is doing, okay? So they're able to look at these images. They've used 9,000 images. Their algorithm is on par with a medical doctor. It's become so accurate that the FDA has approved the use of this without a clinician and said that we will accept the results of this scan with no clinician involved, okay? So it's democratizing things. And then here's another one, Winter Light Labs, another one of these digital therapeutics. And this is all about detecting dementia. And what they've been able to prove is using voice analysis, the way that people speak, the pauses, the inflections, they're able to determine 15 to 20 years earlier than is possible, how people are likely to wind up becoming, to suffer from dementia. So this is something that has gotten a tremendous amount of investment. And they're able to calculate an MMSE score, a mini medical, mental state examination. Thank you, okay?